Good morning. It is the 4th of May 2021. This is Dr. Deepak Natarajan, Chief of Cardiology, Supreme Hospital, Delhi NCR. I will refer to today's news in which Dr. Guleria has recommended or rather disapproved of steroids being used too early in patients with COVID-19. I also have been coming across many prescriptions. In fact, 99% of prescriptions carry steroids in patients who are not yet in hospital, who have an oxygen saturation ranging from 94 to 98%. Now, using steroids early is a big no-no. The reason is very simple. Steroids dampen your immunity when you get infected, or rather if you get infected with this virus, then your body will itself produce antibodies to fight this virus, as it does with every other infection. Now, what you need is an immunity booster, not something which dampens or suppresses your immunity. By using steroids in the first 5, 7, 8, or even 10 days, what you're doing is that you are sabotaging your own immune system and thereby actually increasing or prolonging the disease and adding to the burden of morbidity and also, God forbid, mortality. Now, let us talk about the most important study, which was published almost a year ago in the New England Journal of Medicine. This was done by Oxford. This is called the Recovery Trial. I have already spoken about this multiple times in my previous segments. This study was a randomized trial, open label albeit, but it had almost 6,000 COVID-19 patients. Some of them were on oxygen, some were not on oxygen, and some were on a ventilator. Now, what was found was that when you compared a steroid called dexamethasone with standard treatment then, dexamethasone reduced mortality in patients who were on a ventilator by almost 36%. This was about 1,000 patients. In the 1,500 patients who were not on a ventilator but were getting supplemental oxygen or oxygen by a BiPAP, there was again a reduction of mortality by about 18%. However, the most important observation of this trial was that when patients who were not on oxygen, when these were given dexamethasone, there was actually an increased mortality by almost 19%. So therefore, the researchers concluded that dexamethasone was not a good idea in patients who did not require oxygen. The reasoning is simple. I've already explained to you that if you have COVID-19, despite the fact that you have fever or do not have fever, whether you have body aches or do not have body aches, but if your oxygen saturation is above 93%, is ranging from 93, 94% to 98, 99%, there is absolutely no need for a steroid. So beware of any kind of a steroid which is prescribed initially in patients who do not need oxygen. Now, please remember that fever is not an absolute symptom. You could have COVID-19 without fever, but if you are having fever, that is actually a good sign. That means your immune response is working, your antibodies are functioning, they are fighting this virus. The other thing which has to be spoken about is CT scans. Again, I am finding that CT scans are being used by all and sundry. They are being used for diagnosis and also for screening. Now, CT scans were never meant to be used as a diagnostic procedure in this pandemic, because a CT scan which is positive, which shows bilateral GGOs, that is ground glass opacities or some pneumonias, does not alter or modify the therapy. CT scans should not be advised to patients who are outside hospitals. CT scans are only to be used in a patient who requires admission, and then also only in a patient who is going south, who is deteriorating, not in a patient who is stable, because CT scans may or may not confirm the disease. but they do not affect our therapy. The therapy is based on clinical parameters, which is the oxygen saturation and the respiratory rate. And this has been very well brought out by the government guidelines, by the guidelines of the ICMR and the All India Institute of Medical Sciences, which have three columns. The first one is the stable patient who is still outside hospital, who requires antivirals, and these antivirals must be given immediately. Please do not wait for 5 days, 6 days, 7 days, thinking that because the fever is mild, you can wait. The trick is, in fact, the prescription is that the moment you suspect that a person has COVID-19, one must start an antiviral immediately. The antivirals are freely available as of now. I don't know whether they will be sold in black in a few days, but right now the antivirals are ivermectin and also inhaled budesonide. Budesonide is not being used as a steroid, but as an antiviral, as has been shown by two studies from Oxford. Both were randomized. One was a small study called STOIC. The other is a large study of 1,700 patients, wherein the recovery time has been shown to significantly reduced by the use of budesonide. So I will reiterate that if a patient is still outside the hospital, if the oxygen saturation is ranging from 93 to 99%, the patient is reasonably stable, despite the fact that the patient is having fever on and off, the patient is slightly breathless, the need of the minute is to start antivirals immediately. If the patient lands up in a hospital because of a falling oxygen saturation, then the clinicians over there will look after the patient. And a CT scan is not mandatory for diagnosis because it does not help in the treatment schedule. Thank you very much. Please bear these two things in mind.